We're breaking down the standard venipuncture procedure step by step, focusing on how this will be tested on your phlebotomy certification exam. The exam will not just ask you to list the steps in order. It will test your critical thinking within each step. The most critical first step in any venipuncture procedure is always positive patient identification. An exam question might ask, what is the first action a phlebotomist should take before drawing blood? The options might include greeting the patient, applying the tourniquet, or identifying the patient. The correct answer is always identification, using at least 2 identifiers like full name and date of birth, and matching them to the requisition form. After identifying the patient and gathering supplies, you'll position the arm and apply the tourniquet 3 to 4 inches above the selected site. The exam loves to test the 1-minute rule. A common question is, what is the maximum recommended time a tourniquet should be left on the arm? The answer is 1 minute to prevent hemoconcentration, which can alter test results. After selecting a vein by palpation, you must cleanse the site with an antiseptic, typically 70% isopropyl alcohol. A frequent exam trap involves the drying time. You must let the site air dry completely. A question might ask what can occur if the alcohol is not allowed to dry. The answer is that it can cause a stinging sensation for the patient and can lead to hemolysis of the specimen. Once the site is dry, you will anchor the vein firmly 1 to 2 inches below the site and insert the needle, bevel up, at a 15 to 30 degree angle. The exam will absolutely test you on this angle. An angle greater than 30 degrees risks puncturing through the back wall of the vein, while an angle less than 15 may result in a shallow stick that doesn't fully enter the vein. Once blood flow is established, you must follow the correct order of draw. This prevents the additives from one tube from contaminating the next. To remember the most common order, use this mnemonic: stop light red, green light go. Stop stands for sterile blood cultures. Light red stands for light blue, then red or serum separator tubes. Green light stands for green tubes, and go stands for lavender, then gray. A question might present a list of ordered tests and ask you to select the correct sequence of tubes. Remember to release the tourniquet as the last tube is filling, but before you withdraw the needle. After withdrawing the needle and activating the safety device, apply pressure to the site. The final and arguably most critical step for specimen integrity is labeling. The exam will test this with scenarios like, when is the appropriate time to label the blood collection tubes? The only correct answer is immediately after the draw, at the patient's side. Never label tubes before the draw. Correctly following these steps and understanding the rationale behind them is essential for both patient safety and passing your exam. For free practice questions, AI-powered explanations, and more exam prep tools, visit openexamprep.com. That's openexamprep, all one word, .com.